Welcome to the Clinical Cantonese class provided by Family Care Physiotherapy Clinic. Today we will do some practice to see the whole sentences of Cantonese. We will start with questioning because of the topic today. We're going to do the patient interview. Before that, let me share a little bit basic grammar of Chinese if you are English speaker and haven't learned Chinese before. For English to Chinese actually is more straightforward because our grammatical structures are the same. Start with subject, verb, and then object. So some other Asian like Japanese and Korean are different because there are sentence structures, subjects, object followed by verb. So the orders are different. That's why the translation between Chinese and Cantonese is rather easy already. Other characteristic of the grammar of Cantonese is that we have very minimal tenses. No matter past tense, future tense, present tense, it doesn't affect our verb form much. No need to count about the verb form according to the singular, plural. We don't have such rules. Another characteristic of pronunciation is that all of the characters are single syllable, short vowel. So we just one pronunciation and very short vowel. That's why it may give an impression that we are very loud and very rude because of the characteristic. Actually, it's not. Okay. I have some suggestion. Although I show you about the grammar of Chinese and Cantonese, I suggest learning a language. If you are not in school, don't learn it as a subject. Don't always think in your mind, okay, what is the grammar, what is the form. Just like learning bicycle and swimming. Practice, practice, and practice. Just like what I learned English. Yeah, don't treat it as a subject, it's so boring. Okay, let's start to practice some sentences and then be reminded the following sentences are not direct translation. Okay. First of all, what problem do you have? We say in Cantonese that 你有咩事啊? 你有咩事? Okay. Of course, it's a very generic question, but in the content of clinical interview, the people know that you ask what problems bring you here. Then they will say about the history of what happened to you, what is your main complaint, and then where is your pain, something like that. Although it's a generic question, but it's useful in the first sentence. The second one we have learned in previous lesson, just consider as a revision. Where is your pain? We in Cantonese we say that 你邊度痛? 你邊度痛? In your mind, can you recall that we mentioned different area of pain? Can you recall it? Okay, this is a rather longer sentence. In our content is that if you suspect any neurological symptoms or nerve compression, we ask these questions. Do you have pins and needles or a numbness feeling? Okay, in Cantonese we ask, 你有冇針吉或者麻痹嘅感覺? 你有冇針吉或者麻痹嘅感覺? Okay, this is a rather long sentence because of two objects here, pins and needle and numbness, two objects. So this question is rather important for differential diagnosis for every single healthcare professional. In English, we ask what positions or activities can worsen your pain, and then in Cantonese, we ask 咩位置或者活動會令你痛多咗啊? You can hear that I add two tone at the end, 痛多咗. Sometimes when it's similar to Singlish, okay, we say la at the end. In Cantonese, it's quite the same. So repeat as 咩位置或者活動會令你痛多咗? Okay, so it's Cantonese expressions. And we ask how to worsen the pain, and we also ask how can alleviate the pain. So in Cantonese, we ask 你做咩嘢可以減輕痛楚？你做咩嘢可以減輕個痛楚？ Then you can hear that sometimes I use 咩啊咩嘢啊 is a very useful common Cantonese questioning word. Very useful. Only in oral Cantonese. In traditional Chinese, you don't find it. So are the sentences difficult? Doesn't matter. Just practice. Yeah. If you use this wrongly, no one blame you at least, and your patient will appreciate that because you take effort to try. Okay, so try and practice. And also, all the content I share with you here are the very verbal form. It's so much different than when you from when you attend lesson and when you learn from the textbook. Just like I learn English, sometimes I learn English a very textbook form when I use in daily activity. Some English speaker find I'm a little bit unusual because you know the difference. That's why I told you when you learn the language, don't learn it as a subject. We learn textbook language. Sometimes it's not fully practical in daily life. Learn us as practice it. Similar to the previous lesson, at the end, I would like to share with you some Cantonese culture. Today, I recommend a song for you, a Cantonese song. You know, when you sing Cantonese, because we have 8 tones, and then Mandarin Chinese are 4 tones. So if you try to listen to the song, you have more variety in the intonation. Then that's why we appreciate Cantonese song. When you learn the language, yeah, maybe this is not a good idea to practice with song because sometimes their pronunciation is not fully accurate because need to go with the lyrics. So just for your appreciation, it's good. Sorry that I'm not very skillful in PowerPoint presentation, so I can just attach this picture and the link of this MV. You can find in the video description. I hope you like it. So thank you very much for the lesson. I see you again next time. Thank you.